Welcome to our channel. Embark on a journey through our video series dedicated to comprehensively covering the content of the CITB book, Health, Safety and Environment Test for Managers and Professionals. Throughout these videos, we delve into the crucial topics outlined in the book. Section A, Legal and Management. Section B, Occupational Health, Well-being and Welfare. Section C, General Safety. Section D, High-risk activities. Section E, Environment. Section F, Specialist activities. In this particular video, we focus on Section B, Occupational Health, Well-being and Welfare. For your convenience, a link in the top right corner of the video allows easy navigation through the entire series. We are certain that by engaging with this video series, you will be thoroughly equipped to effectively handle your CSCS card. Keep in mind, the CSCS test typically lasts around 45 minutes, and scoring at least 45 out of 50 questions correctly is required to pass. Before we delve into the content, please show your support by liking and subscribing. Your support means a lot to us. Let's embark on this learning journey together.
You are working in a safety-critical role and have purchased over-the-counter medication due to feeling unwell. What action must you take to protect the safety of yourself and others? Inform your supervisor immediately of the medication's possible side effects. Do not come into work until you have completed the course of medication. Continue your normal duties, but inform your colleagues of your potential symptoms. Come in later and leave earlier to reduce the daily hours you are working. Which one of the following must support a drugs and alcohol policy that is being introduced? Education of the harmful effects of misuse. Arrangements of the service level agreement. Increased number of mental health first aiders. Agreement from all supply chain companies. Which one of the following is a reason why recreational drug and alcohol misuse must be considered in a substance misuse policy? It is a risk to the individual and others if they are at work and still under the influence. It is an employer's duty of care to highlight the risks of misuse outside of the workplace. It will ensure that a prescribed limit is defined to control out-of-hours misuse. It will act as a deterrent and reduce the number of recreational users in the company. Why is it essential to manage the misuse of psychoactive substances in the construction environment? To gather data in line with a drugs and alcohol policy to help control health and safety risks. To mitigate the risks of an individual's altered mental function and emotional state. To provide evidence of an embedded behavioural safety culture when tendering for future work. To remain competitive in the sector in order to attract and retain a high level of talent. A construction company is introducing a drugs and alcohol D&A policy to improve their health and safety arrangements. Which of the following essential components need to be included in this policy? 1. Education and information throughout all levels of the organisation. 2. A summary of the D&A service provider and their collection officers. 3. A thorough training programme for D&A appointed persons. 4. The prevention and rehabilitation support offered to employees. 1 and 2 only. 2 and 3 only. 1 and 4 only. 4 and 3 only. When considering the risks of the effects of drug and alcohol use, employers need to consider the implications of misuse outside of the working environment. Is this statement true? Yes, employers must make it clear that the misuse outside of the working environment will not be tolerated. No, employees' conduct outside of the working environment is out of the employer's contractual control as it has no impact. Yes, recreational misuse by an employee can have an impact on the health and safety of everyone in the working environment. No, it goes against an employee's human rights if an employer interferes and controls recreational misuse. The Legionella bacteria that cause Legionnaire's disease are most likely to be found in which of the following? A boiler operating at a temperature of 80 degrees centigrade. An infrequently used shower hose outlet. A cold water storage cistern containing water at 10 degrees centigrade. A cold water supply directly from the mains. Achieving a good level of occupational health on a construction project will be adequately achieved if the health risks are identified at the project design and planning stages. Health risks are discussed at the project planning and execution stages. External occupational health provider is given an overview of the health risks. Health risk control measures are followed during the execution phase. To comply with the control of lead at Work Regulation 2002, which one of the following will form part of the health surveillance programme? A lung function test. A blood test. An audiometry test. A visual skin examination. Health surveillance and monitoring programs are the most important elements in regard to managing an organisation's occupational health risks. Is this statement correct? Yes, health surveillance and monitoring are legal requirements and are the foundation for managing these risks. No, although they identify health risks, they are only a part of a much bigger occupational health strategy. Yes, health surveillance and monitoring systems are the only accurate way to establish the health risks. No, they are not the most important elements, but they need to align to the outcomes of risk assessments. Which one of the following could cause occupational dermatitis? Working for long periods of time wearing gloves. Contact with another person who has dermatitis. Contact with oily clothing and rags. Working in the sun without sun protection. Why must solvents not be used to clean hands? They remove the protective oils from the skin. They will severely burn the skin. They will block the pores and ducts of the skin. They can cause skin cancer. Identify one cause of irritant contact dermatitis. A substance that dries out on the skin resulting in skin damage. A reaction from your immune system that affects the skin. Medications weakening the skin and blood vessels within. excessive exposure to ultraviolet light on unprotected skin. Which one of the following is a bacterial disease associated with the presence of rats? Psittacosis, leptospirosis, mesothelioma, Legionella. You are working near a watercourse and you start to feel unwell with flu-like symptoms. Which one of the following actions must you take? Go and see your doctor and explain your working environment. Continue working and see if you start to feel better. Inform the site health and safety advisor. Take some medication and have a few days off work. You are working on a brownfield redevelopment site where a number of health hazards have been identified. Which two of the following areas on site could pose a risk of workers contracting Legionella? Areas with a heavy covering of dried pigeon droppings. Areas where rats are nesting or have been nesting recently. Areas with quantities of rust, sludge, scale and organic matter. Areas with plaster walling that contains infected animal hair. Areas with redundant water storage tanks where the water is stagnant. When testing the water quality of cooling systems, the service provider reported results that identified a risk of Legionella growth. Which of the following two conditions in the cooling systems would have identified this risk? 1. The water temperature in some parts of the system were between 20 to 45 degrees centigrade. 2. The system was free from deposits of scale and organic matter. 3. The system had evidence of water droplets that could be circulated. 4. The water temperature in all parts of the system were between 30 to 55 degrees centigrade. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 3 only. Which one of the following organisational factors can be consequences of workplace stress? Inadequate health and safety. Improved communication. Business efficiency. Robust decision-making. You have observed that a member of your team has stopped engaging in meetings and lacks concentration. You are concerned these could be early indicators of work-related stress. As a manager, what should you do next? Discuss your concerns with the employee, make reasonable adjustments, and guide them towards an employee assistance program. Discuss your concerns with the employee and ask them to think about how they can improve their engagement and concentration levels. Give the employee a copy of the health and well-being policy and ask them to choose an intervention that may help them. Monitor the situation with the employee for a few more weeks, and if the symptoms escalate, have a discussion about support and intervention. You notice that a recently promoted worker has stopped having breaks with the others and is always last to leave at the end of the day. What could this be an indication of? They could be trying to impress the management on site because they are looking for a pay rise. They could be suffering from stress, and an informal catch-up should be arranged as soon as possible. They could be trying to cover up other people's mistakes, and an investigation needs to take place. They could be taking materials from the site, and checks need to be carried out immediately. When developing a questionnaire to gather information from employees about work-related stress, which one of the following question categories is the least likely to gather reliable and valid data? The level of communication and sharing of information. The physical working environment. The type of work and how it is designed. The access to training and awareness courses. Which one of the following must be in place when providing shower facilities on a site? Shower cubicles that can be locked and are sufficient in number for both men and women to use in a communal welfare area. Shower cubicles that can be used by men and women but separated by a partition within a communal welfare area. Shower cubicles that can be used by men and women within a separate lockable room accessible to only one person at a time. Shower cubicles that can be used by men and women at pre-booked time slots which can be used by only one person at a time. What has to be done if a site is going to temporarily shut down over a holiday period and the toilets do not flush a week before this scheduled closure? Put a sign on the door explaining that the toilets are out of order. Arrange to get the toilets fixed as soon as possible. Arrange for a number of portable toilets to be provided. Ask one of the contracted plumbers to fix the toilet flushers. When will the use of private facilities, such as toilets in a local restaurant, be permitted for contractors to use? When there is no alternative and the duration of work does not exceed 1 week. When the project is at groundwork stages with limited personnel on site. When there is no alternative and the duration of work does not exceed 1 month. When the workers refuse to use the temporary portable toilets provided on site. To ensure legal compliance of the welfare arrangements when completing a project site setup, which two of the following must be taken into account? That all the facilities are detailed in the construction phase plan. That the opening hours of the canteen can cater for peak project numbers. The cleaning and maintenance regimes of the facilities. The consequences of vandalism highlighted in the health and safety policy. That a fully stocked first aid room is provided and staffed by a qualified nurse. The Food Safety and Hygiene England regulations state that food intended for sale or supply must adhere to specific temperature controls to ensure safe levels. Which of the following are the two regulated temperatures? 1. Must be hot at or above a minimum temperature of 63 degrees centigrade. 2. Must be cold at or below a maximum temperature of 3 degrees centigrade. 3. Must be warm at or above a minimum temperature of 37 degrees centigrade. 4. Must be chilled at or below a maximum temperature of 8 degrees centigrade. 1 and 2 only. 2 and 3 only. 1 and 4 only. 3 and 4 only. As part of the site setup of basic welfare facilities, which of the following must be in place to accommodate men and women? 1. Wash basins must be equal in number to the number of toilet cubicles. 2. Showers must be available in case dirty work occurs during the build. 3. Facilities must be pre-booked via an electronically auditable rota system. 4. Wash basins must allow for the washing of face, hands and forearms. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. Which one of the following is an example of indirect discrimination in the workplace? An employer who does not recruit a visually impaired person as they do not like guide dogs. An employer who does not interview an applicant due to their race and cultural background. An employer who only gives full-time employees the chance of promotion and further development. An employer who unfairly treats an employee over others because they are a family member. Workplace harassment of one of your colleagues is occurring. Although you are not the target of this harassment, you are legally entitled to pursue a claim. Is this statement correct? Yes, as long as you have the evidence that an offensive environment is being created. No, it is not involving you, so is not detrimental to your working environment. Yes, as you feel it is not acceptable and it needs to stop immediately. No, it is just a case of banter between colleagues that has gone too far. When promoting an equality and diversity culture on site, what must employers provide to enhance health and safety productivity and improved working conditions? Clearly understandable safety information and messages. A process for workers to follow to suggest improvements. A series of toolbox talks for staff that focus on the subject. Giving certain workers responsibility for raising awareness. When displaying notices and signs on site to inform everyone of the first aid arrangements, what needs to be considered? That they are luminous and can be seen in a variety of weather and light conditions. That they are understandable for workers who have language or reading difficulties. That they only placed at the site entrance and in the welfare areas. That they contain the phone number of the local Health and Safety Executive HSE office. When planning an emergency response to an incident involving a casualty, what do all workers on site need to know? How to place the casualty in the recovery position. The location of first aid kits and first aiders. How to submit an online incident report. The location of the nearest ambulance station. What would be the most appropriate way to inform staff and visitors about the location of first aid facilities on site? Make sure they read the site notices. Ask them to speak to the site manager. Make sure they attend the site induction. Ask another site worker to tell them. You have been asked to deliver a site induction to an architect who will visit regularly and a group of students who will visit once. What would be your main consideration? 1. The students will only need to know about the main hazards as they are visiting once and they will be escorted at all times. 2. Both sets of visitors will need to be escorted at all times. Only permanent members of the workforce can have unescorted status. 3. Both sets of visitors will be subject to the same hazards, risks and control measures, which means they can attend the same induction. 4. The architect will need a thorough and detailed induction as they will be visiting regularly and will likely need unescorted visitor status. 1 and 2 only. 3 and 4 only. 2 and 3 only. 1 and 4 only. You are delivering a site induction to new workers and are trying to highlight the importance of the site's sign-in and sign-out process. What 3 explanations would you give to support this? That failure to comply with this requirement may result in disciplinary action being taken against offenders. That the main purpose of this is to make sure that all persons are accounted for in the event of an emergency. That it is a legal security requirement under the Counter-Terrorism and Security Act 2015 and that non-compliance could shut the site down. That this is used as a timekeeping tool and inaccurate entries could result in a reduction in pay or non-payment of overtime. That the sign-in and sign-out sheets must be sent to the Health and Safety Executive HSE at the end of each month as part of health surveillance monitoring. That anyone unaccounted for in an emergency will be treated as missing and may put emergency workers at risk when looking for someone who isn't there. Regular fire evacuation drills help to inform workers of crucial emergency procedures. Should the drills happen at the same time each week? Yes, this will accurately measure the efficiency of the procedures in place and the effectiveness of the evacuation training. No, drills are not required every week. It is just as effective to discuss the evacuation process with the workers. No, workers can prepare for the drill, which reduces its realism and fails to test workers' knowledge of the evacuation process. Yes, this allows workers to preempt the evacuation and shut down or isolate any machinery that they may be using. Your site has activities that include excavations and working at height. How would you comply with legislation and ensure that new workers involved with these activities were aware of the hazards and emergency procedures? By referring to Schedule 5 of the Construction, Design and Management Regulations 2015 and asking them to read the Emergency Procedures document. By referring to Schedule 2 of the Construction, Design and Management Regulations 2015 and distributing a leaflet that contains information on the hazards, locations and emergency procedures. By referring to Schedule 1 of the Construction, Design and Management Regulations 2015 and erecting signs detailing hazards and emergency procedures. By referring to Schedule 3 of the Construction, Design and Management Regulations 2015 and developing a site induction that is specific, highlights risks and includes emergency procedures. When should an automated external defibrillator, AED, be used on a person? When they are suffering from severe shock. When they are having a stroke. When they are suffering from heavy bleeding. When they are having a sudden cardiac arrest. Where must eye wash stations and burns kits be located? Only in the areas that might need them. in the site office with the site manager, at the site entrance with the security guard, where they can be easily accessed by all workers. The potential hazard of flying fragments produced by grinding operations has been identified. Mains tap water is not readily available for eye irrigation. What should be included in the site first aid box? A set of sterile clinical tweezers with rounded magnetic tips and finger stabilising supports. At least 1 litre of sterile water or sterile normal saline 0.9% in a sealed disposable container. A 500 millilitre can of compressed clinically sterile air in a sealed water-cooled reusable container. At least 1 litre of clinical strength disinfectant or sterile normal saline 2% in a sealed container. Which 2 factors would determine the need for having an automated external defibrillator AED in the workplace? How many of the workforce are or have been regular smokers? How many people may be working in or visiting the workplace? The location of the site in relation to the nearest medical centre. Whether any workers suffer from an asthmatic condition. Whether any work activities could cause amputation of a major limb. Is it good practice to include foil blankets in a site's first aid kit? Yes, foil blankets should only be included during the winter months when it is wet and cold to prevent a casualty developing hypothermia. No, foil blankets are bulky and take up too much room in a first aid kit, which means that essential items will need to be left out. Yes, foil blankets help to retain body heat, and they can be used in winter to keep a casualty warm or in summer if a casualty has gone into shock. No, if you have developed an effective emergency procedure plan and you have appropriate first aid facilities, then foil blankets are not needed. What should be the main consideration when placing first aid equipment around site? It is located in the main site office at all times. It is located in the first aid room equipment cabinet. It is located in a place where it is likely to be needed. It is located with the first aider at all times. Which of the following are key features of an automated external defibrillator AED? 1. They are capable of interpreting a casualty's heart rhythm and delivering an electric shock with minimal input from the operator. 2. They are capable of providing effective cardiopulmonary resuscitation (CPR), which will keep a casualty stable until medical assistance arrives. 3. They are the only device that can prevent death from a heart attack and have a high success rate for casualty recovery in the UK. 4. They are programmed not to deliver a shock to a casualty unless detecting the presence of a heart rhythm that requires defibrillation. 1 and 2 only. 3 and 4 only. 1 and 4 only. 2 and 3 only. Which one of the following is a main responsibility of an appointed person? Carry out first aid duties if a qualified first aider is not present. Assist the qualified first aider with triage and monitor all unconscious casualties. Contact the emergency services and direct them to the scene of the accident. Apply plasters, dressings and slings to minor wounds and burns. A first aider can assist an individual to take their prescribed injectable medicine, but they must never administer it themselves. Are there any exceptions to this rule? Yes, a first aider can inject any medicine as it is a skill covered on the first aid course, but they must gain consent from the casualty first. No, a first aider would be charged with grievous bodily harm, GBH, if they were to inject any medicine into a casualty. Yes, a first aider can administer injected adrenaline, such as an EpiPen, for the purpose of saving the life of a casualty. No, a first aider must never inject any medicine. They should call 999, make the casualty comfortable, and wait for professional help. Which one of the following would be the most suitable to help you identify your first aid requirements? British Red Cross First Aid at Work Manual. First Aid Approved Code of Practice, ACOP. Health and Safety First Aid Regulations, 1981. The Workplace Health, Safety and Welfare Regulations, 1992. Which two of the following factors must be considered when providing first aid facilities on site? The cost of training staff to become qualified first aiders. The hazards, risks and nature of the work being carried out. The health, fitness and medical history of all staff and visitors. The space in the site office to store the necessary equipment. The maximum number of people expected to be on site at any time. Although a first aid certificate is valid for 3 years, the Health and Safety Executive, HSE, recommends that first aiders undergo annual refresher training. What is the main reason for this? To assess whether an employer has a proactive approach to the health, safety and well-being of staff. To provide evidence of continual training which will help to prevent a prosecution after an incident. To give employers an opportunity to reduce accidents at work and lower their insurance premiums. To help qualified people maintain their skills and keep up to date with changes to first aid procedures. You are conducting a first aid needs assessment on your site, which has 110 workers. How many first aid at work, FAW, trained staff would you need to comply with the Health and Safety First Aid Regulations 1981? 2. 1 FAW for every 60 workers. 3. 1 FAW for every 50 workers. 4. 1 FAW for every 30 workers. 5. 1 FAW for every 25 workers. Following a first aid needs assessment, which of the following additional training is likely to be relevant on all types of construction sites? 1. Application of hemostatic dressings and/or tourniquets. 2. Management of a casualty suffering from hydrofluoric acid burns. 3. Management of a casualty suffering from cyanide poisoning. 4. Management of a casualty suffering from hypothermia or hyperthermia. 1 and 2 only. 3 and 4 only. 2 and 3 only. 1 and 4 only. Although the assessment of first aid does not need to be formally recorded, why is it considered good practice to do so? If an accident occurs, employers can use their written documents as evidence during legal proceedings, which will prevent them from receiving a fine or custodial sentence. The information will help the first aiders on site to choose the contents for the first aid boxes and to identify and purchase any specialised medical equipment. Employers can demonstrate to a safety representative, the Health and Safety Executive (HSE) or local authority inspector how they decided on their level of first aid provision. Employers can print the findings of the first aid needs assessment and distribute them to visitors or new workers during the site health and safety induction. Which three of the following factors should be considered in a first aid needs assessment? The skills, knowledge and experience of the workers. The type of work or operations being carried out. Whether there are special or unusual hazards. The minimum number of people that will be on site. The fitness and agility levels of the workers. The remoteness of emergency medical services. You are responsible for providing first aid on site, including a first aid room. A manager asks you if they can store some electrical equipment in there, as it is rarely used and is a waste of valuable space. Would you agree to this request? No, the signals from the electrical equipment could interfere with specialist first aid kit. Yes, so long as the equipment was stored neatly in a corner and was always kept clean. No, the first aid room should be available at all times and used only for administering first aid. Yes, as long as access to the room is not restricted and equipment is stored neatly under the treatment bed. Which of the following, other than required first aid materials, can sites also provide to ensure a satisfactory first aid room setup? 1. A sink with hot and cold running water. 2. A resuscitation training mannequin. 3. A reclining chair that offers back support. 4. Drinking water with disposable cups. 1 and 3 only. 2 and 4 only. 3 and 2 only. 1 and 4 only. First aid provision must be adequate and appropriate in the circumstances. What should you do to meet this requirement? Provide a qualified first aider for every 25 members of staff and regularly review the contents of the first aid needs assessment. Instruct a qualified first aider and an appointed person to identify the provision that is needed for the site and specific work areas. Conduct a first aid needs assessment and communicate the contents of the assessment to all site workers and the nearest hospital. Ensure that sufficient first aid equipment, facilities and personnel are available at all times, taking account of alternative working patterns. When conducting a first aid needs assessment on site, which one of the following would not need to be given as much consideration regarding the first aid arrangements? If the build sections are spread out across buildings and floors. If members of the public are regularly visiting the site. If self-employed workers under the control of an employer are on site. If inexperienced workers or employees with disabilities are working on site. You are observing a first aider conducting an emergency response simulation mock-up exercise, which involves an unconscious worker lying on the floor next to an electrical cable. What is the first thing that the first aider should do? Locate a wooden pole or stick and move the cable away from the casualty. Assess the situation and identify any danger to themselves or others. Move the worker away from the cable and out of immediate danger. Tell the appointed person to get the automated external defibrillator, AED. A worker has fallen into a safety net and has sustained injuries. Which one of the following procedures should now be used to prevent further injury? Use a mobile access tower, MAT, to gain height access and send a first aider onto the net to assess the casualty. Send a first aider and appointed person onto the net to then assess the casualty and apply necessary first aid. Pull the netting so it is taut, then send a first aider onto the net to assess the casualty and wait for the paramedics. Use a mobile elevated working platform, MEWP, to gain height access and then bring the casualty down safely. Under the Health and Safety First Aid Regulations 1981, which of the following are identified as duties of an appointed person? 1. Providing emergency cover within their competence where a first aider is absent due to unforeseen circumstances. 2. Investigating all first aid related incidents and producing a report that provides detailed statistics. 3. Supporting the first aider to prepare, distribute and administer medication on sites with more than 100 workers. 4. Looking after the first aid equipment and facilities and calling the emergency services when required. 1 and 2 only. 1 and 4 only. 2 and 3 only. 3 and 4 only. A visitor has arrived on site to assess a worker carrying out a grinding activity. They have no eye protection with them. What action must you take? Provide them with impact-resistant goggles. Escort them off the site immediately. Issue them with standard safety glasses. Advise them to return when they have suitable eyewear. When issuing personal protective equipment, PPE, to a worker, which one of the following must be taken into account? That it fits correctly, allowing for safe working. That it can be modified for maximum comfort. That it meets personal choice and preferences. That it is easily trackable for cost allocation purposes. When purchasing eye protectors and shields from a new supplier, it is a legal obligation that they are all individually marked to identify their type and suitability. Is this correct? No, it is the responsibility of the supplier to ensure that records are retained of the batch type and suitability. Yes, it is one of many requirements which ensure compliance with British and European specifications. No, the process of marking the polycarbonate material could seriously reduce the level of protection. Yes, it is a requirement of the British Safety Industry Federation, BSIF, which represents manufacturers. It is important for an operative to wear suitable eye protection while working with irritant materials to ensure An effective seal around the eye area. Clear visibility at all times. The eyes do not become dry. Compliance with mandatory requirements. When operating an angle grinder, what is the significance of wearing a BSEN 166 rated face shield as opposed to safety glasses? 1. It gives protection against medium energy impacts. 2. It is suitable for withstanding high-speed particles. 3. It allows the air to flow and prevent fogging. 4. It is face-fit tested to give a secure seal. 1 and 2 only. 2 and 3 only. 1 and 4 only. 1 and 3 only. When employers are selecting the most suitable protective footwear for specific types of on-site activity, which one of the following must be carried out? An assessment of its suitability in line with the nature of risk. A hazard identification assessment of the work environment. A cost projection analysis of its return on investment. A plan to identify a systematic and timely training program. Which one of the following is the main reason for steel toe-capped safety footwear? To protect the feet from dropped objects. To protect the feet from oil contamination. To provide protection on uneven surfaces. To provide extra cushioning around the toes. You are planning work where operatives have to break up reinforced concrete slabs using handheld pneumatic concrete breaking drills. For this type of activity, wearing anti-vibration gloves is recommended to achieve the necessary level of protection. Is this correct? Yes, only correctly fitted gloves approved by the machine's manufacturer should be used. No, they reduce the flexibility of the hands, resulting in higher grip and push forces. Yes, they keep hands insulated when operating machines that cause vibrations such as drills. No, to achieve that level of protection will require specially designed protective equipment. You are carrying out a risk assessment for a task using stain removers to clean paint and graffiti from concrete and brickwork. The work will be conducted in a city centre at night and during the winter. Which two types of gloves would be the most suitable for this task? Nitrile, chrome leather, Nomex, heavyweight rubber, reinforced leather. When selecting head protection, the Personal Protective Equipment at Work Regulations PPE 2022 state that it must be suitable. Which two of the following define the term suitable? Must be adjustable to fit the wearer and be compatible with other equipment worn at the same time. Must be of a type that can be stored correctly after its use and maintained in good condition and repair. Must be appropriate for the risks involved without increasing the overall risk and conditions of exposure. Must be stamped with its expiry date and have a reversible cradle so it can be worn back to front if required. Must be kept with the user manual and recommendations for its safe maintenance and storage. On site, you see an operative safety helmet fall off and drop onto a concrete slab from a height of approximately 2 meters. Which of the following statements will apply? Safety helmets are manufactured and designed to offer a predetermined level of impact resistance if they fall off or have been dropped onto a hard surface. A safety helmet that has fallen from height onto a hard surface may have suffered damage that will affect its strength. Even though no cracks are visible, it should be replaced. A safety helmet that has fallen from height should be inspected by a competent person and should be replaced if it has been damaged or is showing visible signs of wear and tear. Many safety helmets have built-in features that enable them to fall or be dropped onto a hard surface without suffering damage that will affect their strength. Which one of the following must be considered when selecting suitable hearing protection? Suitability for use with mobile phone earphones. Handling and fitting of the hearing protection. Information, instruction and training for employers. Compatibility with other safety equipment. All workers should be provided with information, instruction and training on how to fit and use disposable earplugs. But should they be shown how to check the quality of the earplug fitting? Yes, they should know how to conduct a sound check, which requires the use of specialist audiometry equipment. No, a sound check is not required, as once the worker is exposed to a noisy area, they will know if the fit is good. Yes, they should know how to conduct a visual depth check, as correctly fitted plugs will not be visible from the front. No, they do not need to carry out a visual depth check, as the supervisor will do this for them and advise if the fit is good. Your risk assessment has identified the need for hearing protection on site. If you choose ear defenders for the workers, which factors must you consider? 1. Ear defenders might not be suitable and may cause ear irritation or infections, as they can become excessively dirty. 2. Thick frames on safety eyeglasses can affect the fit and seal of ear defenders and reduce attenuation levels. 3. Fitting is critical for ear defenders, as they offer an improved level of hearing protection and comfort compared to other earplugs. 4. The practice of wearing earphones under ear defenders may mask auditory warnings and reduce awareness. 1 and 2 only. 2 and 3 only. 1 and 3 only. 2 and 4 only. Work is about to start on a housing development project located on private land. There will be lots of vehicle and plant movements, and access will be needed for delivery drivers. How would you achieve the minimum visibility level required for these hazards? Provide high visibility waistcoats with one 5 cm band of reflective tape around the body. Provide high visibility vests with 3/4 length sleeves and 2 5 cm bands of reflective tape around the body. Provide high visibility vests with 2 5 cm bands of reflective tape around the body. Provide high visibility long sleeve jackets with 2 5 cm reflective bands around the body and braces over the shoulders. Which one of the following high-visibility clothing sets must be worn by workers in proximity to a live dual carriageway road with a speed limit of 50 miles per hour or above? Vest with 2 5cm bands of reflective tape around the body, or 1 5cm band around the body and braces over both shoulders. Jacket with 3/4 length sleeves and trousers, 1 5cm band around the body and braces over both shoulders. Overalls with 5cm bands of reflective tape around the body, braces over both shoulders and reflective bands around each leg. Long sleeve jacket and trouser suit with 2 5cm bands of reflective tape around the body and arms and braces over both shoulders. Class 2 medium visibility clothing is required to be worn by workers in which 2 of the following circumstances? When working in areas such as highways maintenance and railways. When working on or near A and B class roads. When working on sites with vehicle or plant movements. When working on or near dual carriageways. When working near roads with a national speed limit of 60 miles per hour or above. High visibility clothing is designed to protect the wearer from all harm by making them easily visible to vehicle and plant operators, as well as the travelling public. Is this correct? Yes, it is designed to protect the wearer from all physical injuries while working on a site by visually alerting vehicle drivers and public traffic to the presence of workers. No, it is designed for workers in some specific roles, such as highways operations, and allows their supervisor to check on them easily from a distance in any lighting conditions. Yes, it is designed for workers in industries where a particular background colour is specified for clothing, such as fluorescent orange for railway workers. No, it is designed to make the wearer easy to see under any light conditions in the day and under illumination such as vehicle headlights in the hours of darkness. Your employees are going to be carrying out repair works to an airport runway and site access roads. What significant features must the personal protective equipment issued to your workers provide when equipping them for this type of work? 1. The clothing provided must be weather appropriate and include a hood that can accommodate a safety helmet. 2. The clothing must be a different high visibility colour to that issued to airport airside employees to avoid confusion. 3. The clothing issued must be of the highest visibility level and meet the Class 3 standard. 4. The clothing issued must have a clearly defined contractor identification band on the back. 1 and 2 only. 2 and 4 only. 1 and 3 only. 3 and 4 only. You have to carry out emergency repairs to a footpath running adjacent to a mainline railway. Your team are wearing Class 2 high visibility fluorescent yellow jackets with 2 5cm bands of reflective tape around the body and braces over both shoulders. Is this suitable personal protective equipment, PPE? Yes, the clothing must conform to the relevant British standards and to the requirements laid down by the rail network in that it must be clean and worn correctly at all times by workers. No, there are colour restrictions for items of clothing worn by operatives working on or near a railway, and yellow clothing must not be worn in case a train driver mistakes them for a signal. Yes, the minimum PPE for this type of work is high visibility yellow upper body clothing with reflective tape which complies with the principal contractor's requirements. No, the minimum PPE for this work is orange, high visibility long sleeve jackets and trouser suits with 2 5cm bands of reflective tape around the body and arms and braces over both shoulders. The main requirements of the Personal Protective Equipment at Work Amendment Regulations 2022 are that 1. It is supplied and used in workplaces where there are significant risks to health and safety. 2. It is properly assessed before each use to ensure it is suitable. 3. It is supplied and used wherever there are risks that cannot be controlled in other ways. 4. It is inspected regularly and only maintained by a competent person. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. As required by the Personal Protective Equipment at Work Amendment Regulations 2022, your site management team needs to carry out an assessment to determine whether the personal protective equipment PPE you intend to provide will be suitable. Which one of the following common items of PPE should also be risk assessed for suitability under the requirements of other health and safety regulations? A high-visibility jacket worn to minimise the risks of contact with vehicles or when moving plant. A construction safety helmet used to protect against risks from falling objects or banging the head. A pair of safety gloves used to prevent the risks of dangerous chemicals penetrating the skin. A pair of safety boots worn to prevent injuries from dropped objects and penetration of the sole. Providing personal protective equipment PPE should be one of the first considerations after discovering a significant risk to the health of your employees. Is this correct? Yes, PPE should be one of the first considerations for tackling the immediate risk while other control measures are being developed. No, PPE should only be considered where a risk has been identified and it cannot be adequately controlled by other means. Yes, PPE should be a primary consideration for controlling significant risks in conjunction with technical and organisational means. No, PPE should be only considered as a short-term control measure as opposed to eliminating the significant risk at source. Under the requirements of the Personal Protective Equipment at Work Amendment Regulations 2022, in order for personal protective equipment to be deemed as suitable, it must meet which of the following criteria? 1. It takes account of ergonomic requirements. 2. It fits after making the necessary adjustments. 3. It takes account of individual characteristics. 4. It is freely available in a range of different sizes. 1 and 2 only. 1 and 3 only. 2 and 3 only. 2 and 4 only. When selecting personal protective equipment PPE, which one of the following principles must be considered first? It must be supplied with information of how to use it safely. It must be appropriate for the risks and exposure conditions. It must not affect the performance of the worker. It must be adjustable so that it provides a correct fit. Which of the following is the most effective way of preventing or eliminating the presence of respiratory hazards on a construction project? Providing suitable protective equipment to all workers on site to control residual risk. Ensuring there is a dedicated cutting area provided to avoid dust getting into the air. Using water suppression on all cutting equipment that generates or creates dust. Planning for the manufacturing or cutting of materials at a location away from site. Which one of the following control measures would reduce airborne dust from a circular saw? Attaching a suitable extraction unit. Opening windows in the area. Fitting a wider cover to the blade. Fixing a water suppression system. Which one of the following can be implemented to prevent respiratory hazards facing a gang of bricklayers? The introduction of block splitters. The use of respiratory protective equipment. The implementation of task rotation. The increase in health surveillance. Identify 2 management principles that will control dust hazards in the workplace. Any expected exposure must be controlled to an acceptable level. All employees are informed of all control measures in place. Risk assessments are completed at least 2 days in advance. All work is done outside in the open to ensure adequate ventilation. All new starters are informed about the health effects of dust exposure. It is important to control wood dust when cutting or sanding wood because it can cause occupational asthma and nasal cancer, emphysema and lung elasticity loss, silicosis and scarring of the lung, pleural thickening and pulmonary disease. Construction dusts can cause irreversible health conditions through regular and uncontrolled exposure. Is this correct? Yes, these illnesses normally take many years to become visible and can be paralysing or fatal. No, sites manage and control operations that create dust to minimise exposure to workers. Yes, exposure can cause a range of conditions, including effects such as chronic coughing. No, personal protective equipment is issued to all workers to prevent uncontrolled exposure. You are chasing out walls inside a small room. Identify 2 control measures to prevent workers from exposure to airborne dust. 1. Use the correct on-tool dust extraction or water suppression and wear a high-efficiency face mask like FFP3. 2. Open the windows and door to allow the dust to escape into the atmosphere. This removes the need for a mask. 3. Use the on-tool dust extraction or water suppression and keep everyone else from entering the room to prevent exposure. 4. Open the door and windows and wear a face mask when dust starts to build up to prevent or reduce exposure to dust. 1 and 2 only. 1 and 3 only. 1 and 4 only. 2 and 4 only. Identify 2 control measures that will help to prevent exposure to diesel fumes in an area where free movement of air is restricted and there is no ventilation. Workers must wear personal monitors to warn of carbon monoxide buildup. A banksman must be present to warn others of the buildup of carbon monoxide. A supervisor must be present wearing personal monitors to control carbon monoxide. Air monitoring in the building must be in place to warn of carbon monoxide buildup. A risk assessment must clearly specify the acceptable levels of carbon monoxide. A worker is using a petrol disc cutter to cut concrete paving slabs. The disc cutter has a suitable dust suppression water bottle, and the operator is not clean-shaven, but is wearing a face mask. Is this adequate protection? Yes. Concrete dust contains very heavy particles which fall to the ground and cannot enter the airway through a small gap in the mask. No, a worker could still be exposed as facial hair only protects against larger dust particles that can be seen by the human eye. Yes, using the dust suppression water bottle will eliminate the risks to the operator from harmful levels of exposure to dust. No, facial hair can create an inadequate fit, which will significantly reduce the protection provided to the wearer. When conducting a welding fabrication task that involves heating up metal, an occupational health risk is created as the operative could lose their vision permanently from the bright arc created. Inhale fine metal particles, causing severe burns to their respiratory tract. Burn their skin with hot metal fragments from the flashback created. Inhale microscopic metal particles created by the fumes cooling down. One reason why an existing gas installation must be inspected by a gas-safe engineer following any refurbishment work is to prevent what type of poisoning? Carbon disulfide, carbon dioxide, carbon hydroxide, carbon monoxide. Which one of the following are the two main types of silicosis workers can suffer from after high levels of exposure to silica dusts in the construction industry? Accelerated and acute silicosis, atrophied and chronic silicosis, acute and chronic silicosis, acute and pleural silicosis. What must your employer provide concerning silica dusts? Information on when to use water suppression as a control measure. Product safety sheets on how to manage and prevent exposure. Toolbox talks on how to use the tool extraction as a safety measure. Employee training on the hazards resulting from any exposure. Which one of the following is conducted as part of a health surveillance program in the stone masonry trade? Urine test, chest X-ray, blood test, eye examination. Which of the following statements describing the effects of asbestosis are correct? 1. Asbestosis is not a form of lung cancer or mesothelioma, so people can live with the disease. 2. Asbestosis is a form of lung cancer that is always fatal, with death often occurring within months of diagnosis. 3. The condition is incurable and will get worse over time, therefore treatment is required. 4. The effects can be slowly reversed after exposure to asbestos has stopped and it is curable. 1 and 4 only. 1 and 3 only. 2 and 4 only. 3 and 4 only. Why is it important to ensure that the appropriate respiratory equipment and dust suppression tools are used when cutting cement blocks on site? To reduce the chances of the worker contracting silicosis. To ensure that the employer meets the current health and safety legislation. To reduce the noise exposure to the worker and surrounding people. To ensure that the employee does not contract lead poisoning from the dust. What health condition might you develop if you work in a dusty environment over long periods of time? Occupational asthma. Occupational dermatitis. Skin cancer. Weil's disease, leptospirosis. Which of the following statements is the most accurate description of the harm that may be caused by exposure to solvent vapours? They deposit bacteria into the body at locations where the most harm can be caused. They can often be toxic, causing chronic effects or dizziness, unconsciousness and death. They are hazardous in enclosed spaces as they quickly build up to dangerous concentrations. They can cause a range of conditions from coughing and sneezing to chronic disease. After knowingly or unknowingly breathing in silica particles over a long period of time, which of the following conditions are construction workers most likely to suffer from due to exposure to low levels of respirable crystalline silica, RCS? Chronic effects such as liver damage, hardening or scarring of the lung tissue, severe or chronic occupational asthma, diffuse pleural thickening of the lung. Which two of the following work processes on site can potentially expose workers to respiratory sensitizers that can cause occupational asthma? Spray painting using 2-pack paints. Cutting slabs, curbs or concrete. Second fix joinery and carpentry work. Oxyacetylene or oxypropane welding. Plant powered by internal combustion engines. You are about to start work in a confined space and you will be using an engine-powered generator, 110 volts, to power your tools. Which two of the following may be acutely fatal as well as causing long-term consequences such as lung cancer? Carbon dioxide produced by the exhaust polluting breathable air. Unburnt hydrocarbons produced by incomplete combustion of the exhaust. Hydrogen monoxide produced by engine batteries when the generator is running. Carbon monoxide produced by restriction on the movement of air. Dihydrogen monoxide producing vapours as the exhaust is heating up. What might be the health outcome for an individual exposed to noise in the workplace? Permanent and disabling hearing damage. Temporary inner ear imbalance and vertigo. Long-term chronic earache and infections. Continually prone to temporary threshold shift. Which one of the following could be an early indication of hearing damage? Difficulty having conversations where there is background noise. Inability to hear vehicle and plant audible warnings. Needing to increase the setting level of hearing protection. Having to take longer breaks due to the onset of headaches. A large construction project has identified that hearing protection must be worn in certain build sections and will become a mandatory policy requirement. What are the drawbacks of this policy? It will compromise the productivity of workers in these areas. It will take too much management time to ensure compliance. It will increase project costs outside of the allocated budget. It will decrease workers' awareness of all other hazards. When visiting a site, your team needs to complete an inspection that is adjacent to an activity generating a high level of noise which cannot be stopped. Which one of the following actions would you expect the site manager to apply? Arrange for the site health and safety advisor to accompany your team. Make hearing protection available to those who ask for it. Issue everyone affected with hearing protection and ensure that it is worn. Give a toolbox talk on how to work safely in a noisy working environment. If you are suffering from whistling and buzzing in your ears, it is nothing to be worried about, as it is a consequence of working in a noisy construction environment, and these symptoms will subside. Is this true? Yes, this is only a temporary and short-term painful condition. No, this is only treatable when exposure to noise stops permanently. Yes, this is a common industry problem and no permanent damage will be caused. No, this is an early warning of hearing damage and must not be ignored. Nuisance noise can cause individuals to suffer physiological effects, but it must not be compared to the effects of excessive or long-term exposure to noise. Is this true? Yes, nuisance noise is below the level that could damage a worker's hearing. No, nuisance noise is a common cause of noise-induced hearing loss amongst workers. Yes, nuisance noise causes severe hearing complications amongst workers. No, nuisance noise can easily be controlled to remove the impact on workers. When it is not reasonably practicable to remove noise hazards and a level of noise remains, which one of the following must be provided? Suitable training and awareness. Suitable risk monitoring. Suitable hearing protection. Suitable acoustic barriers. When choosing suitable personal protective hearing equipment, which one of the following protection factors is important? It must ensure that all noise is continually eliminated. It must eliminate risks from noise to an acceptable level. It must magnify certain sound frequencies over others. It must ensure comfort and durability when working. You are standing in a busy section of the site with the quantity surveyor. You are stood approximately 1 metre away from each other, but are having to raise your voices to hold a conversation. Why is this happening? The quantity surveyor has hearing aids in both ears, and this is being accounted for as the noise level is only 70 decibels A. You are standing too far apart and need to be much closer to engage in clear conversation as the noise level is around 85 decibels A. Hearing protection is being worn, but the ear protectors have been damaged and the noise level is above 87 decibels A. Hearing protection is not being worn in line with the risk assessment for this area and the noise level is at 90 decibels A. On a construction site where noise levels are not able to be practicably reduced below the upper exposure action value UEAV and where employees are likely to be exposed, what must be put in place to mitigate the impact of noise? A programme of practical workshops demonstrating how to fit and wear hearing protection correctly. Designated hearing protection zones and suitable signage stating that hearing protection must be worn. Provision of suitable hearing protection if a worker requests it as per their own personal preference. Appropriate work rotation aligned with sufficient rest breaks so that hearing protection is not needed. In line with the Control of Noise at Work Regulations 2005, a reliable and representative estimate of workers' daily personal noise exposure must be made. Which one of the following states how this is estimated? Through a combination of how the noisy work is done and how long each worker takes to do the same task. Through a combination of how loud and for how long a worker is exposed to noise in a working day. Through an analysis of daily noise measurements conducted while workers do specific tasks. Through an analysis of calculated peak sound pressure levels that a worker is exposed to in a working week. Which of the following measures will provide continual medium and long-term benefits as part of a construction project's noise control programme? 1. Investing in a buy quiet policy for machinery and equipment. 2. Improving the working techniques to reduce noise levels. 3. Erecting enclosures using absorbent materials to reduce the noise. 4. Maintaining noise-emitting machinery and equipment on a regular basis. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. Why is overexposure to vibratory tools and equipment a serious issue? Its impact and severity on long-term health is still unknown. There are no early warning symptoms, so damage cannot be mitigated. The associated health conditions are difficult to assess and diagnose. It can cause permanent and disabling health conditions. When using a disc cutter, which one of the following might increase the vibration levels? The user maintaining a tight grip on the tool. The tool being operated on its highest setting. The tool's disc always being sharp and clean. The user being relaxed whilst operating the tool. Operatives who have been diagnosed with Stage 2 hand-arm vibration syndrome, HAVS, have been given advice on how to minimise their vascular symptoms. Which two of the following will help the operatives to control these symptoms? To stop cigarette smoking or cut down on intake. To take more rest breaks during the working day. To keep warm and dry in cold and damp weather. To wear anti-vibratory gloves when appropriate. To hold the correct posture when operating a tool. To help control the effects of hand-arm vibration syndrome, HAVS, the exposure action value, EAV, and the exposure limit value, ELV, need to be adhered to. Which one of the following explains how they are measured? By using the tool manufacturer's vibration exposure data to establish an accurate trigger time limit for workers. by observing workers using vibratory tools and equipment and using the data gathered to manage the exposure limits. By analysing a combination of the vibration at the grip point on the tool and the time a worker spends gripping the tool. By calculating the tool's vibratory output at varying speeds compared with the hours a worker has spent operating it. Which of the following are neurological hand-arm vibration syndrome (HAVS) symptoms? 1. Numbness and tingling in the fingers. 2. Reduced sense of touch and temperature. 3. Bone decay and loss of grip. 4. Finger blanching and red throbbing. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 3 only. It is recognised that symptoms of hand-arm vibration syndrome, HAVS, may be intermittent, but with continual exposure to vibration, they could become prolonged or even permanent. Is this true? Yes, and if the symptoms become permanent, it is very unlikely that they will cause any physical pain or psychological impact. No, the onset of symptoms is immediate, and there is no prior warning for the individual to try and minimise the impact. Yes, continual exposure can become a permanent condition and will cause pain, distress, and sleep disturbance. No, although the symptoms come and go, it would only be temporary as it is treatable with medical intervention. Which one of the following is the most effective way of controlling vibration exposure on a construction site? Using equipment with low vibration output. Limiting the operative's trigger time. Maintaining equipment so it remains efficient. Changing the process and avoidance. A group of operatives are using handheld breakers to break up a pavement ready for landscaping. How can this activity be controlled to ensure that the health of the worker is not compromised? Check that the equipment has been regularly serviced before use and that any vibration-resilient components have been replaced. Check that the operatives keep a diary recording their daily tool output in order to protect the company from future claims. Check that, as part of the risk assessment process, individual vibration exposure levels are matching the manufacturer's data. Check that the operatives are issued with anti-vibration gloves and that these are worn when operating the equipment. When installing a new machine in a workshop, which one of the following measures will help to reduce the vibration it produces? Ensuring that it is powered up correctly. Using jigs to hold components firmly in place. Making sure that all guarding is fitted correctly. Ensuring that users are trained on its operation. You are reviewing the risk assessment for an activity involving the use of a concrete breaker. The work is being conducted by experienced ground workers, and the breaker has been fitted with suspended handles to reduce vibration. Which other preventative control measure could be implemented? Reviewing the higher smooth policy to ensure that it remains fit for purpose. Applying the correct operating force to produce lower vibratory levels. Improving operator training to achieve lower vibratory levels in use. Conducting focus groups with the operatives to share best practice. A worker is operating a hammer drill fitted with a vibration timer device, and it has started to emit high-pitched beeps. This notifies the worker that the device is broken. Is this correct? Yes, it has been designed as a safeguard to ensure that the drill is examined for damage, otherwise protection from vibration exposure will be compromised. No, it has been calculated to capture the vibration output that must not be exceeded, so this is a warning to stop as maximum levels have been reached. Yes, these are mandatory automatic alert warnings for malfunctions and are a requirement of the Control of Vibration at Work Regulations 2005. No, these alert warnings are only given when the device recognises that the tool needs to be taken out of service for thorough inspection. Plumbers are removing lagging around pipes to repair a leak in a Victorian building. What is the significant risk to workers' health in carrying out this work? They are disturbing asbestos fibres that can be inhaled. They are releasing flying fragments that can injure a person. They are disturbing bacteria-filled water that can cause infection. They are disturbing the dust gathered that can irritate eyes. Exposure to asbestos can cause which of the following 3 related health diseases? Asbestosis, bronchitis, silicosis, mesothelioma, pleural thickening. You have been asked to carry out alterations on a building built before the year 2000. What would be your first consideration? The building could contain fiberglass insulation. The building could contain asbestos-based materials. The building's finishings could be painted with lead paint. The internal walls could be made from lath and plaster. Why is it important to ensure all workers attend asbestos awareness training? To ensure workers meet the company's asbestos-related health and safety standards. To enable workers to identify potential asbestos-containing materials and to know what to do. To give workers enough knowledge to be able to remove the asbestos-containing materials. To keep workers' training records up to date and in line with legislative information. When an asbestos refurbishment survey needs to be conducted, it should be based on the project's schedule, access limitations, project's requirements, surveyor's fees. Which of the following is true regarding the risks from asbestos? 1. The earlier the date of first exposure, the greater the chance of recovery. 2. The most friable materials need higher levels of control. 3. Mesothelioma can be curable if treated with chemotherapy. 4. If not disturbed or damaged, it may not need removing. 1 and 2 only. 2 and 3 only. 3 and 4 only. 2 and 4 only. Why are cement, mortar and concrete-based materials hazardous to health? They can cause dizziness and headaches. They can cause skin burns and irritant dermatitis. They can cause muscle aches and spasms. They can cause skin sores and abrasions. Site operatives have finished laying slabs and need to wash out the buckets that have stored the wet concrete. Which one of the following actions could they take which would not reduce their exposure to burns from this process? Using the correct cleaning agent along with hot water. Reducing the total amount of time taken to carry out the task. Using suitable washing and changing facilities afterwards. Wearing appropriate personal protective equipment. Why do cement and concrete burns pose such a serious risk to workers' health? They can damage skin nerve endings very quickly. They can increase body temperature rapidly. They can cause a loss of consciousness. They can spread to other parts of the body. Workers are washing out cement buckets on site. What is the main risk to their health? Respiratory difficulties, skin cancer, flu-like symptoms, burns to skin. Which of the following two main health risks can be caused by working with wet cement and concrete? Headaches, dizziness, skin burns, dermatitis, abrasions. You are delivering a health and safety briefing to operatives involved in a scheduled concrete pour. Does this work carry a risk to the operative's health? Yes, wet concrete can cause severe burns that can kill nerve endings, resulting in long-term damage. No, wet concrete can cause skin irritation and redness, but this is only temporary and it will clear up. Yes, wet concrete can cause burns to the skin's surface, but these are easily healed with medication. No, wet concrete is an alkali-containing substance, so it is safe if contact is made with the skin. Painters are using the correct process and suitable personal protective equipment to remove old lead paintwork within a domestic property. What is the next main priority? Ensure workers have a suitable location for rest breaks outside of the working area. Ensure property owners do not enter the working area until complete and the area cleaned. Ensure there are suitable and sufficient welfare facilities for the workers present. Ensure barriers and signage are erected to stop any unauthorised access to the working area. Which three construction activities are most likely to result in a worker being exposed to lead? Stripping old paint from windows and doors. Disturbing sprayed coatings. Repairing old gutterings. Hot cutting during demolition. Cutting slabs, curbs and concrete. Which one of the following could be a consequence to roofers who regularly repair lead flashings on properties? Long-term bronchitis through prolonged periods of working outdoors. Long-term musculoskeletal disorders due to manual handling. Long-term health issues relating to the exposure to asbestos. Long-term health issues relating to the exposure to a toxic material. Painters are preparing paintwork in an old property by dry sanding. What is the significant risk to health from this process? Exposure to flying fragments. Exposure to excessive noise. Exposure to prolonged vibration. Exposure to toxic dust. A painter is using a hot air gun set at over 360 degrees centigrade to remove old paint from a timber frame window. What major health risk could they potentially be exposed to? They could be at risk of inhaling asbestos fibres. They could be at risk of receiving third-degree burns. They could be at risk of inhaling lead fumes. They could be at risk of being exposed to heat radiation. What are the 2 reasons why painters and decorators are advised to wet sand paintwork? 1. To produce a superior quality finish. 2. To reduce the risk from cuts and abrasions. 3. To stop possible toxic dust becoming airborne. 4. To reduce the noise levels from the process. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 3 only. A risk assessment for demolition work has identified a low exposure and concentration level of lead-based materials. What additional steps must be put in place by the employer to reduce health risks? Monitoring and recording the exposure levels of all workers. Displaying suitable warning signs highlighting the health risks. Cleaning all personal protective equipment after use. Stopping eating, drinking or smoking in contaminated areas. What is the next biggest health risk to construction workers after asbestos? Leptospirosis, silicosis, Legionnaires, bronchitis. Labourers are not following the safe system of work issued and have decided to dry sweep an area where stonemasons have been cutting sandstone blocks. Why is the process of dry sweeping creating a significant risk to their health? The sandstone dust can cause sensitizing dermatitis. The escape of silica dust can cause lung cancer. The mixture of all ground dusts can cause respiratory asthma. The bending action can cause musculoskeletal disorders. The 3 main effects inhaling respirable crystalline silica (RCS) can have on a person's health is that they can develop lung cancer, heart valve disease, chronic obstructive pulmonary disease, deep vein thrombosis, silicosis. Workers exposed to low levels of respirable crystalline silica (RCS) over a prolonged period will have no long-term health issues. Is this correct? Yes, this will have no effect on the person because the levels are minimal. No, inhaling even a small amount of toxic material can affect a person's digestive system. Yes, this long time frame allows the body to recover and regrow damaged tissue. No, there is a risk that this will cause hardening and scarring of the lung tissue. Exposure to respirable crystalline silica, RCS, is harmful to a worker's health as it can increase the risk of kidney disease, cause deep burns and damage nerve endings, develop into acute asthma that is not reversible, cause recurring eye infections that require surgery. You are writing a risk assessment for the refurbishment of an old bathroom, and one of the main tasks to be controlled is the removal of tiles from the walls. Which one of the following, if not controlled sufficiently, would be the main health hazard of this work? If the tiles are broken into sharp fragments, they could puncture the skin, causing hepatitis. If large dust clouds are created and then inhaled, there is a chance of contracting asbestosis. If bare skin makes contact with dirty tiles, then bacteria can be ingested, causing CITB. If fine dust particles are created and inhaled, there is a chance of contracting silicosis. You are writing the risk assessment for stonemasons who are working on a historical restoration project which involves carving and removing rock, sand and clay. Which one of the following would you list as the main health hazard? The inhalation of fine dust when shaping materials can cause breathing difficulties and acute silicosis. The moving and handling of materials into position can cause muscle fatigue and back injuries. The constant hitting of materials with various hand tools can result in acute tendinitis. The manipulation methods used to shape materials create fine fragments that can penetrate skin. Which one of the following is not a key stage of a control of substances hazardous to health, COSHH, risk assessment? Eliminate the use of the substance. Identify who is at risk from the substance. Erect suitable warning signs on storage areas. Identify the hazardous substances. If it is not reasonably practicable to prevent exposure of workers to substances hazardous to health, which of the following must be considered first? The instruction, training and supervision required. The use of sufficient control measures to control exposure. The introduction of health surveillance arrangements. The continual monitoring of workers' exposure. Work procedures for decorators need to be changed from applying paint by hand to using a spray application. What main document needs to be reviewed before these changes can be implemented? The provision and use of work equipment risk assessment. The material safety data sheets. The health surveillance guidance. The control of substances hazardous to health risk assessment. You have been made aware that workers on site are using a highly toxic cleaning agent unsafely, and you are not certain if the necessary paperwork is in place. Which two of these options are the first you must implement to reduce the risks to these workers? 1. Review the personal protective equipment PPE being worn by workers and make them aware of the hazards. 2. Erect appropriate barriers to stop any unauthorised access to the work area and display warning signs. 3. Stop the work immediately, ask the workers to leave the area and thoroughly ventilate the workspace. 4. Instruct a competent person to carry out a control of substances hazardous to health, COSHH, risk assessment. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. Inhaling old mold spores during demolition work can expose workers to which one of the following diseases? Aspergillosis, leptospirosis, Legionnaire's disease, silicosis. A painter is using a highly pressurized airless spray gun to apply paint to a large volume of walls and ceilings. Which one of the following is a major health risk of this work? The potential for a respiratory condition to develop from the release of hazardous fumes. The potential for loss of hearing due to the noise levels emitted. The potential for nerve damage to develop from the high level of vibration exposure. The potential for loss of a finger, hand or arm due to fluid injection. Absorption of a hazardous substance happens when it passes through the stomach after digestion, then into the bloodstream. Passes through unbroken skin or cuts, then into the bloodstream. Passes through the skin by piercing, then entering the bloodstream. Passes through the lungs by breathing in, then filters into the bloodstream. Painters and decorators working on old lead paintwork are at risk of toxic substances entering their body by which of the following two ways? 1. Injection through the skin by the tiny sharp particles created during sanding. 2. Absorption through the skin by directly touching it with fingertips. 3. Ingestion if it is on the hands during eating, drinking or smoking. 4. Inhalation of the fine dust particles created by the sanding process. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. Which two of the following are not stated in a Control of Substances Hazardous to Health COSHH risk assessment? Properties of the substance. Local toxic waste disposal sites. Activities that create high exposure. Meanings of symbols on the substance. Information on health effects. What procedure must employers put in place if a worker is liable to be exposed to substances hazardous to health? Appropriate medical insurance. Access to a health physician. Appropriate health surveillance. Access to mental health support. What is the main purpose of carrying out health surveillance on employees who regularly work with hazardous substances? To detect any medical problems as early as possible. To allow appropriate first aid equipment to be in place. To identify changes needed to substance suppliers. To protect against future medical compensation claims. In a joinery workshop that assembles large quantities of hardwood doors, suitable control measures have been implemented following a Control of Substances Hazardous to Health COSHH assessment. Which one of the following will be the next stage? To update the assessment within the next 6 months. To carry out regular monitoring routines to ensure efficiency. To inform all first aiders of the potential health risks identified. To issue the assessment to all affected operatives. You are coordinating the clean-up process of a hazardous substance spillage on site. The correct personal protective equipment, PPE, has been issued to the workers involved. It is important that these workers also maintain a high standard of personal hygiene whilst carrying out this work. Is this correct? Yes, it ensures that the PPE issued is kept clean and maintained properly and can be safely used by other workers after the completion of the task. No, employers cannot insist that employees keep themselves clean whilst at work and the PPE covers them up whilst completing the task. Yes, it ensures that cross-contamination is significantly reduced after the PPE is removed, supporting control measures for the task. No, this has no impact on the quality of work that employees produce, as long as they wear the PPE correctly when completing the task. A team of labourers need to undertake work activities within a segregated area of the site, which will require the use of hazardous substances. What must now be implemented to ensure that these hazardous working activities are effectively controlled? Constant supervision during the tasks to ensure that workers are adhering to the safe system of work. Toolbox talks to make workers aware of how to identify a toxic material and how to use it safely. Training sessions to provide workers with information on how to act safely in the event of a toxic spillage. Instruction and training to raise worker awareness of the dangers of exposure and the precautions to take. Which one of the following details must be included in a safe system of work before using a hazardous substance? Information on required training. Information on health effects. Information on environmental impacts. Information on the supplier. Under the Control of Substances Hazardous to Health Regulations, COSHH 2002, which one of the following legal requirements is an employer not expected to do? Identify harmful substances that may be present in the workplace. Establish how workers will be exposed to the materials and be harmed. Provide monitoring and health surveillance when appropriate. Facilitate training sessions on the risks of exposure to lead. A quantity of new hazardous substances have arrived on site and they have been stored together without referencing the safety data sheets. Which one of the following could be a consequence? They could get mixed up with old stock and affect application. They could react with each other and cause a major incident. They could be logged incorrectly and alter stock control records. They could be unsafely stacked and overloaded, resulting in spillage. You are writing a Control of Substances Hazardous to Health COSHH risk assessment. How could the safety data sheet that accompanies the substance help you? By confirming how much material can be effectively applied per square metre to complete the task. By determining the type and correct affordability of the personal protective equipment required. By identifying the possible health implications and severity of risk posed to those using the material. by establishing that the quantities purchased are sufficient in number for completing the task. During the early stages of site setup, which of the following must be considered first regarding the storage of hazardous substances? 1. The location of the storage containers. 2. The segregation requirements. 3. The access and egress for delivery. 4. The supply level requirements. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. You are in charge of setting up a new construction site. What must be done when a control of substances hazardous to health risk assessment has determined that certain substances on this site will need to be stored separately? Create a suitable storage area with adequate ventilation and extraction facilities to hold all identified materials within the zone. Install a suitable storage area with boxes to hold appropriate safety equipment for material use stored within the zone. Identify a suitable storage area and check the material's compatibility with others to be stocked within the zone. Make sure a suitable storage area is positioned next to the site office and that segregation shelves are installed within the zone. Which two of the following would be priorities before carrying out any manual handling lifting activities? 1. Discussions with the workers about the risks involved in the task. 2. A full risk assessment of the task with the results recorded. 3. Checking and logging the delivery of the load before unloading starts. 4. The installation of extra barriers and signage around the site loading area. 1 and 2 only. 2 and 3 only. 3 and 4 only. 1 and 4 only. What do the Manual Handling Operations Regulations 1992 require an employer to do? Manage, control and reduce the risk of injury. Allow employees to assess their own abilities. Identify and list all heavy loads on site. Make employees accountable for their own operations. From the list below, select the 4 main factors that need to be considered when assessing a manual handling operation. Individual, environment, time, load, equipment, task, length. The worker has come to you with concerns about the load they have been asked to move. They think it might be too heavy for them. They cannot divide it into smaller parts, and there is no one to help them. What would you advise them to do? Do nothing until a safe method is identified. Instruct the forklift operator to help them lift the load. Try to use the correct lifting method. Lift and move the load quickly. If your workers are not following the safe system of work when moving slate tiles onto a roof, what must you do? Find out why they are doing it like that and change the risk assessment accordingly. Identify who started doing it that way and issue them with an on-the-spot verbal warning. Let them carry on, as no injuries have occurred and they are getting through the work faster. Tell them to stop and that they need to follow the agreed procedure for the task. Which two of the following are needed before an individual lifts a heavy load? 1. Appropriate training and guidance. 2. Personal protective equipment. 3. A back support belt. 4. A completed risk assessment. 3 and 4 only. 1 and 2 only. 2 and 3 only. 1 and 4 only. Under the Manual Handling Operations Regulations 1992, it is an employer's responsibility to do which one of the following? Select the correct tools for the task. Advise how long the task will take. Implement appropriate control measures. Inform the worker how much they can lift. In line with the Manual Handling Operations Regulations 1992, which 3 factors should be in place to protect employees from injury when planning lifting activities? Employ the correct people for the work. Provide appropriate training and information. Consider everyone's physical suitability. Supply correct footwear and clothing for the work. Ensure lifting tasks are shared out evenly. Do the Manual Handling Operations Regulations 1992 also include the use of mechanical lifting equipment to help with a task? Yes, as the mechanical aid does not fully eliminate the task. No, because the mechanical device is lifting the load. Yes, because the mechanical aid is doing all the lifting. No, because the lifting is mechanical, not manual. Identify which two of the following would not be classed as a manual handling activity under the Manual Handling Regulation 1992 as amended 2002. Working on a scaffold from a height, throwing bricks down a rubble chute. Moving a small load by hand above shoulder height to another area at the same height. Carrying out maintenance on plant by using a spanner with manual downwards force to release a bolt. Using a hoist to lift roofing materials to height, then unloading these by hand. Carrying out demolition of a wall by striking it with force using a large sledgehammer. From the options below, identify 3 key pieces of information that must be included in a manual handling risk assessment when the activity cannot be avoided to enable the task to be completed safely. Contents of the load. Full weight of the load. Where the centre of gravity is. Material the load is made from. Where the heaviest side of the load is. How can employers address the impact of musculoskeletal disorders on their employees? Encourage them to take absence days to recover. Encourage them to report any pain or discomfort. Encourage them to take medication to manage pain. Encourage them to read manual handling guidance. Why is it important that workers wear appropriate protective gloves when handling cement bricks? Select 2 correct answers. They reduce the risk of vibration white finger. They reduce the risk of cuts and abrasions. They reduce the risk of skin disease. They reduce the risk of osteoarthritis. They reduce the risk of repetitive strains. How might an individual sustain a limb crush injury when carrying out a manual handling activity? Moving loads erratically, resulting in falling against an object due to loss of balance. Poor lifting techniques resulting in being trapped by the load. Wearing poorly fitting clothing that becomes trapped by the load. Moving materials while wearing the incorrect personal protective equipment. Which one of the following is the most common cause of a meniscal lesion or tear damage? Twisting or bending a knee when carrying a load. Lifting a small light load too near to the body. Lifting a large heavy load with a pallet truck. Twisting the shoulders when loading a cement mixer. Before carrying out a team lift of a heavy load, which one of the following is an important element to consider? There are at least 4 people helping with the load at the same time. The people lifting the load are about the same size and build. The people lifting the load are all the same age and gender. The lifting is carried out on a level concrete surface. What is the first thing that an employer needs to consider when introducing vacuum lifts to reduce manual handling tasks? The increased costs involved in installing and maintaining this equipment. The introduction of new risks that will have to be considered and assessed. The extra training that will be required for the plant mechanics to install. The new procedures and operating techniques that will be required for safe use. An employer has introduced automated manual handling aids into their safe systems of work. Which 2 of the following will not be appropriate? Battery-powered pallet truck. Cylinder trolley. Conveyor system. Roller track. Powered hoist. For roofers who are currently transporting tiles up scaffolding by hand, the introduction of which mechanical aid will be most effective at reducing the manual handling risks they face? Rotary table. Dual lifting hook. Material hoist. Lift truck. When manual handling tasks are unavoidable, which 2 solutions could help to significantly reduce the risk of injury? Computerization. Motorization. Standardization. Automation. Mechanization. A labourer is experiencing back pain, possibly caused by moving 25 kilogram sacks of materials into a mixer. Which one of the following could stop this injury from happening again? Use bigger bags handled by a forklift truck and redesign the feed chutes. Use smaller bags and rotate the workforce and limit working time. Change the materials used to a lighter product that will be easier to lift. Stop the work altogether and ask for a design change to the building.
Congratulations on your progress. Every step brings you closer to your goals. Keep embracing knowledge until you achieve your desired success. Look for the link in the top right corner to seamlessly transition to the next video.